Hey guys, this is Ebony. I'm just checking in with you. I got my vertical sleeve gastrectomy on the 20th. So on Tuesday, February 20th, I went into the hospital to get my procedure done and I'm home now. Today's the 22nd. I came home yesterday. So I was only there about a day and a half. I went in early morning. My surgery was around 8 a.m. Um, the last thing I remember was them giving me some Versed, and then I woke up in the PACU recovery. When I first woke up, I was in a lot of pain and I was very, very nauseous. They had to give me multiple doses of pain medication and nausea medication to kind of keep that under control. They were giving me morphine for pain, which I felt like it didn't really help me that much. The highest pain level I ever had was about an 8 out of 10. And what the pain kind of feels like your insides are pulling, if that makes any sense. Like you can really, every time you move or shift yourself or try to sit up or stand, you just really feel that tension of it pulling, and it does hurt. Um, but the morphine, like I said, I felt like if my pain was an 8, it brought me down to about a 6, maybe a 5. But I didn't feel like it worked the best for me. So I came out and I was in PACU holding for about 6 hours until I got a room. And when they rolled me into the holding, I immediately got up off the stretcher and walked to a recliner chair, sat in a recliner chair until I got a room, walked from the recliner chair to the stretcher, and then when I got to my room, I walked off the stretcher to the bathroom, and then I actually took my first walk around the unit. And then I sat in the recliner chair. I stayed in the recliner chair the whole hospital stay. Um, it just felt better for me. I didn't want to be in the bed at all. Um, Especially with trying to get the air out of my stomach and burp and things like that. It was just easier for me to maneuver myself in the chair more comfortably. So I stayed in the recliner chair all night. Um, Around 6 p.m. that night, the night of surgery, I was allowed to start drinking. Well, sipping, they say. They give you like the little clear medicine cups, and you're supposed to drink one of those every 15 minutes, but obviously sip it slowly. You don't want to gulp because it can make you nauseous, it hurts, it's uncomfortable. So I started out with actually ice water, and I couldn't even tolerate the water being that cold, which I'm usually a person that likes really cold water. So I was just doing room temperature water. They did let me order a tray, which was just like clear liquids, and I ordered chicken broth, jello, sugar free jello, and sugar free ice pops. I took a little bit of an ice pop, I took a little bit of broth, and I took a little bit of jello, and I wasn't a fan of any of it, especially the jello and the ice pops. Even though they were sugar free, I felt like they were super, super, super sweet, and I really was not a fan of it. Um, they also changed my pain meds around at that time. So they had stopped the morphine, and because I was able to sip, now I was able to have my pain meds in liquid form. So they started giving me Percocet in liquid form. That seemed to really control my pain. Um, if I had a pain of 7 out of 10 and I took the Percocet, whether it be 5 milligram or a 10 milligram, it would bring my pain down way down to like a 1 or 2. And at that point, it would be more of like just a little bit of discomfort, but very doable. I would take those pain meds, and within 5 to 10 minutes, I was like ready to go and go for a walk. I felt great. So the Percocet worked really well for me. It didn't make me super loopy or drowsy, but it did make me a little bit drowsy. So I would go for walks, and I'd be up talking to my family and stuff, but I would start to doze off a little bit. Plus I was just tired and going through a lot from surgery. So but the Percocet worked really well for me. So yesterday, I got discharged around 1 p.m. I was doing really well, walking around on my own, going to the bathroom on my own. I did have family with me the whole time, so they were able to help me with things. I didn't really have to bother the nurses. One thing they did ask me before I got discharged was if I was passing gas, which I wasn't, but I was burping, and they said they were okay with that. that they really wouldn't expect me to start passing any gas or anything like that until today, now Thursday, the 22nd, once I'm home and able to take in a little bit more than what I was taking in at the hospital. So, the other thing that they did before discharge was they went over my medications and all that stuff, and they went over my diet. The bariatric coordinator um, went over the diet with me and over the bowel regimen because they don't want us to go longer than 4 days without a bowel movement. So we went over all those things as well before being discharged, and then got to come home yesterday. Um, and so when I initially, I have had my gallbladder out, and I figured this was going to be similar to it, and it was, but it was, I will say, it was more painful than my gallbladder. But I also feel as though I'm moving better, quicker than I did with my gallbladder, which is kind of weird, but I was in more pain. I'm in more pain than I was with my gallbladder, but I feel like I'm recovering a little bit faster than I did with my gallbladder, which I don't know, it's kind of weird, but that's just how I feel. So I did not sleep in my bed last night, so I'm just going to kind of show you a little overview of that, kind of my setup. It's nothing fancy, but so this is my couch. This piece here is like elongated, and you can kind of see. These are all my pillows. So I have all these pillows. These were behind me. This pillow is for my head. And this pillow I use to splint my stomach. And I actually brought this pillow with me to the hospital. So when I would get up out of the chair or when I would go to sit in the chair, I would hold this pillow against my stomach and it would really help control some of the pain. I also have a little table here with goodies. So I have some, this is actually Gatorade mixed with water. It's the G2, low sugar, because high sugar doesn't mix with bariatric patients typically. So I diluted it with some water because even though it's sugar free, I really, sometimes when I was drinking it, I was having a hard time. Here's a half a bottle of water. Here's my pain medication. This is a protein shake. I tried to drink this today, Premier Protein. I tried to drink this today. I got about halfway. So I think I did okay. I mean, they want you to try to get at least one in for the day, but I just couldn't. This is also my incentive spirometer. Everybody will get one of these as well. Helps you, you blow into it, helps expand your lungs, prevents you from getting pneumonia, blood clots, and stuff like that. And then I just have like all my chargers and stuff. I basically just had everything within arm's reach, so I didn't have to go too far. The other thing that I did start today was taking Miralax. This is technically a laxative, but it's a very, very minor laxative, I guess you could say. More, in my eyes, like a stool softener. It uses the water in your body to soften the stool in your intestinal tract. So it's not very harsh on the body. But I did start taking that today because, again, it's important to have a bowel movement. Even though we're not taking in a lot, there is something in there. And with the pain medications, it can really bind you up. So a lot of times after surgery, especially getting as much medication as you may be getting with a surgery like this, you might need a stool softener or, a suppository or something like that. But you want to start out with the least invasive thing. So, the Miralax, take a cap full of that, mix it in with 4 to 6 ounces. I did 4 ounces just because right now, I'm just on the sipping method right now and just taking a little bit at a time. So I didn't want to have this big cup of medication to drink. So I did it in 4 ounces and you really don't taste it. I mixed it with the G2 Gatorade and some water. And I also started taking all my medications today. The one thing I wasn't sure about was my vitamins, but the bariatric coordinator actually called me this afternoon to see how I was doing, how I was feeling, how my pain was, how my stay was, if I had any questions. And she did confirm with me that it was okay for me to start taking my vitamins today, but to just be careful because it can make you get nauseous. So I will show you my medications and stuff. Because I did get the sleeve, I had to come home on a blood thinner for 13 days. And unfortunately, it's not a pill form. It's actually an injection that has to go into your stomach. So I'll show you guys that, all my meds and stuff. I'm just going to sit this down here for a second. So this is my blood thinner. It's called Lovenox. This is what it looks like. So this is the top here. This is the cap. So you just like peel this back. This is the top. You pull that off, and then there's a skinny needle. Clean your belly with some alcohol. Pinch the skin a little, and you just push it in with the plunger here. And once this plunger is all the way pushed in, there's actually a plastic mechanism here that will shoot over the top of the needle to cover it so that you don't stick yourself. So I did that today. It wasn't bad. I'm also a nurse, so I know how to give this, and you know, it really wasn't anything bad. The needle is really tiny, so it really doesn't bother that much. The other thing I started taking today was my omeprazole. And the thing with this, and you'll find out if you do get the surgery, you'll be on this most likely afterwards, and this just kind of protect your belly and, you know, help you absorb things, prevent you from getting acid reflux and stuff. But with this, it's a capsule, and the inside, the medication inside is in like little beads. And in order to take this, we have to, us bariatric patients, we have to open them up and pour the beads out. So what I did today was I poured the beads out onto a spoon, just so they didn't go everywhere. I poured them out onto a spoon, and I put them in my mouth, and I took a sip of my protein shake, so that it could kind of like mask any type of medicine flavor that it would have. And that went fine as well. The other thing, like I said, I did today was I started with my vitamins. So I'll show you those. This is my multivitamin. And I actually was able to get all my vitamins from the pharmacy at the hospital. My hospital has a pharmacy, like an outpatient pharmacy in it, that you can go and get prescriptions filled, or you can just buy things like this. They actually, the place where I got my surgery has an entire unit that's dedicated to weight loss surgery patients. So the pharmacies actually carry a lot of vitamins, protein shakes, all types of products that cater to weight loss surgery patients. So it's pretty nice. So I actually got all these things at the pharmacy there, and I was able to get my medications. When I got discharged from the hospital, I went right down to that pharmacy, picked up my meds before I left the hospital, and I went home. I had everything. I didn't have to go to the store or anything like that, so it was nice. So this is my multivitamin. It's by the brand Bariatric Fusion, and this is the tropical flavor. And I'll just show you what it looks like. So that's the size of it. I'll show you in my hand. So it's about, I would say, maybe the size of a quarter, maybe a little smaller. And then the other, this is a different brand, Celebrate, but they do cater to bariatric patients. And this is iron with vitamin C. I have iron deficiency anemia, so I have to take an extra iron supplement on top of what I get in my multivitamin. They also recommend it for women that are of menstruating ages to take an extra iron supplement as well. So this is the iron, and this is the multivitamin and iron. So they're quite similar in size. The iron is a little bit smaller, and this is a berry flavor. Pretty good. I just literally was biting them off in little tiny pieces, just taking my time because I didn't want to get nauseous. And it wasn't bad. It really wasn't bad. My stomach tolerated them just fine. And then the other thing that most weight loss surgery patients need to take is a calcium supplement. So I chose to get this, the Viactive Calcium Chews, and it's milk chocolate flavor. Even though I'm supposed to be on liquids, they did say these were okay as long as I chewed them really well and let them dissolve in my mouth, which they do dissolve quite easily. But this is what it looks like. And it honestly looks and smells like a little Tootsie Roll. But you can taste like the chalkiness of the vitamin inside of it. But it's doable. It's really not bad. All the vitamins were pretty good. Um, and so that's what it looks like. Just a little, it looks like a little chocolate. Um, and it was pretty good, honestly. I don't have any complaints about it. Um, Pretty good. I think they also come in caramel flavor, which I'm not the biggest fan of, so I got the chocolate. Um, so that was pretty good. Like I said, everything I tolerated pretty fine. Oh, the other thing I will do is I will try to show you my incisions. So it's going to get a little graphic, and I apologize, but I'm just going to, keep it honest with you guys. So I have 6 incisions, and I apologize for the lighting. Um, so here's 1, 2, 3, and I had gauze covering these because they were leaking a little bit. Um, Here's 4. This is my biggest incision, number 5, and number 6. So the drainage has actually slowed down a lot today. I was able to take a shower today. Um, Sorry, I still have like some tape residue on me. The reason why I don't have them fully taped down is because of the residue from the tape and because they don't want you to scrub. So after I took my shower, I didn't want to put more tape and have to deal with more gunk. So I just put one little piece. And as you can see, I have my pants down really low because I just don't want anything bothering it. I happen to be very tender right in here. This is my biggest incision. I'm sure this is probably where they pulled my stomach out of. Um, so yeah, those are my incisions, and I have most of my pain on this side here. I still do have pain on this side, but it's mostly in this region here for me. So that's what my incisions look like. Not bad. Um, so yeah, I'm doing pretty good. The other thing I did want to mention was the Biotine mouthwash. I brought this with me to the hospital. It's for a dry mouth mouthwash, and I used that like right when I got up to my room because I couldn't have anything to drink, and my mouth was so dry. I felt like I was literally gonna die. I was so thirsty. My mouth was so dry. That really, really did help. So I would recommend it. I do think it comes in a spray, but I couldn't find the spray, so I just bought the mouthwash. I figured I'll just use it, whatever. It'll probably help me in the first couple days anyway, where I'm not taking a lot in. So yeah, the other thing is too, today's my post-op day 2, and I have only taken 2 of my Percocets today. One in the morning, and I took one in the early afternoon after I got out of my shower. I'm walking around. I feel pretty good. I am also cooking dinner right now for my boyfriend. I know some people might think that's crazy. You're like teasing yourself, but I'm really not that hungry. So yeah, that's kind of where we are with things right now. I'm doing pretty good, and that's the update. So I will keep you posted. I will probably check back in a couple days and just let you guys know how everything is going.